I'm here with Deborah and board-certified plastic and hand surgeon, Dr. James Coleman, who performed the surgery. Welcome to both of you. Can I shake your hand?
Gotcha.
Just 2 days after surgery.
Yeah, she's done great. But she was a perfect candidate for a number of reasons. Number one, she's extremely active. She's a wonderful patient. She's very compliant. And she was one who had an injury to the opposite hand, and we wanted to do everything we could to minimize the stress on the left hand and get her returning to her normal activities as soon as possible.
So explain to us a little bit what happens with carpal tunnel, the process, pressure on the median nerve.
So carpal tunnel syndrome basically describes a set of symptoms that people have when, as a result of too much pressure on the median nerve at the wrist. And medically, as you know, they have numbness in the thumb, index, middle fingers. And what I'm finding is that people are delaying being treated because of some of the stories and misunderstandings about the prior surgery.
And I think that is such an important point, that if you delay treatment, then you can get yourself into real trouble, permanent damage to the nerve, which in turn weakens your muscles.
Correct, correct. And possibly make the results of the surgery not only less optimal, but actually can get irreversible nerve damage.
Tell us about the new technique. So it's so-called MANOS, which is hands in Spanish,
That's
right?
correct. That's
but it was
correct.
named after a Dr. MANOS who
was the inventor of
technique.
it and who was in Silicon Valley, correct.
Okay.
And so the advantage of this new technique is that it is the absolute least invasive way of treating carpal tunnel syndrome. The incision is basically the size of an IV. And it cuts the ligament, which compresses the nerve, underneath the skin. And as you can see in the example here, there's a deployable blade that comes through the skin. And this is the actually sawing back and forth motion. But again, the key is the size of the incision. And this is, again, about the size of an IV. The blade is retracted and removed, and a Band-Aid is put on the incision sites.
Yeah, and you see that. I mean, just tiny, tiny incisions just a couple days ago. And
So this is about 36 hours after surgery. And in terms of mobility, she has full range of motion. Deborah was just telling me she was actually packing and unpacking yesterday.
So a great new option, not having to go through the open procedure, because we know that larger scar in 60-something% of patients was painful and
correct, and not for everyone. There are indications. The patient's awake, alert throughout this procedure. They need to be able to have enough sensation to give me feedback during the surgery. So if you wait too late, it may not be something that's best for you.
And I think that's the take-home point is if you have symptoms of carpal tunnel, don't delay in having it evaluated by your hand surgeon. Well, thank you, both of you.
Thank you very much.
Good work, good stuff.